I'm the academic person who talks a little bit about what this condition of social anxiety is about. And I really think it's really more interesting. I do have slides, PowerPoint with graphs and all the things that are required of academic people. But for me, I think it's much better to tell the story about what this condition is like by following along with someone who's struggled. This is a video that's commercially available that I've used many times. His name is Larry. And Larry has a story that sounds a bit common, a bit similar to what we've heard about today, but we're going to use his story to help illustrate some points about what social anxiety is. So go ahead.
At a local junior college, and my career ambition is to be a journalist. I worked for quite a while as a journalist, and I haven't been able to get back into that. And a while back, I got a teaching credential to teach high school English and Spanish, and I haven't done that because I'm a little bit timid about getting in front of a group of students. I've always had...
So what's Larry teaching us right now? He's teaching us something really important about social anxiety disorder. He's telling you that one of the things that matters most to him in his life, his vocation, his way to make a living, he's telling you that this shyness, this being a little, he calls it a little timid, has really redirected his choice in his career. So Larry has social anxiety disorder. What is social anxiety disorder? It's a fear of embarrassment. It's a fear of scrutiny by other people. It's really, people are often, with social anxiety, are usually concerned about a few things. Making a mistake that will be judged in some negative way. That's a pretty common part. But actually, even more common is that people often worry about being judged emotionally. Like, gee, is that person shy, or is that person flushed, or in a way, it's just as much of a fear of kind of revealing your human imperfection, revealing your emotional imperfection, as it is making a mistake or looking silly. So Larry has this fear of social situations that has begun to interfere with his life, and actually has interfered with his life, well, throughout his entire life course. A lot of us would be afraid. I sometimes imagine what it would be like if we had a bowl of everyone's name here, in a big bowl, and we drew your name, and your job was to come up and sing the national anthem. I can only imagine what it would be like as I drew that name out, how many of us would be so worried that that name would be ours. Because we all know that we have the ability to feel socially shy, timid, concerned, worried about being judged. We all have that feeling when we meet someone new. Sometimes that might be the case when we have to perform. But we could engineer a circumstance here where almost anyone would be afraid. The key part in social anxiety disorder, which you hear from Larry, is the impact on his life. If I were to take a poll in this group, what are the things that matter the most to you? My guess is that we'd end up with 4, 5, 6 things. And they would center around these areas: romance, friendship, work, school, the things you like to do for satisfaction, enjoyment. Those are the big areas that most of us really care, that we really care the most about. And if you had generalized social anxiety like Larry has, it's very likely that many of those areas would be impacted. Romance and friendship and work and school have definitely been impacted in Larry's life. So in a way, when you're kind of judging, do I have social anxiety disorder, or am I just like anybody else who wouldn't want to sing the national anthem here? The key part is, how much is it interfering with your life? And for many people with social anxiety, the impact is profound. And in Larry's case, this impact in work is particularly important. One of the things that I do is I'm a mental health intervention researcher, and we've been designing, developing, and testing a specialized treatment to help people with social anxiety get back to work and remain working. We found that social anxiety disorder, when you look at the functional impacts of it, we call it functional impact, those big 5 things that we talked about, the work domain is particularly relevant, and very relevant for Larry. We once had an economy that was driven primarily through manufacturing. And if I'm a very shy factory worker applicant, I'm probably a good choice. I might be happy in my solitary work on the line, I might not organize a union. I might not spend extra time at lunch talking. I'd probably be on the job and probably be very reliable in my solitary work. But many of the jobs out there now that people have are social. We have a service-based economy, a growing service-based economy that leaves people like Larry and other people with social anxiety often in a tough situation. So we found that of all the mental health disorders that you can think of in the United States, the one that seems to have the largest impact on work is social anxiety disorder. And Larry exemplifies that. He's moved from one job to another job, but he still hasn't been able to find his niche.
A real problem with the way I feel about myself, and I can trace it back to when I was in junior high school, in high school, early college years. I could not talk to another human being. I absolutely
could not. So what Larry's telling us here is that this has been with him a long time. And for people with generalized social anxiety like Larry, there's really two subtypes of social anxiety disorder. One subtype is the generalized subtype, where most social situations are difficult, like in Larry's circumstance. And then there's a specific subtype that usually surrounds performance, like public speaking or performing in front of others. And, Larry's telling us a story here about his life, and this has been with him for a long time. It's very likely that he was constitutionally shy from his very first years, and that this has been a struggle for him throughout. It probably got worse in his teen years, but he's probably had this trouble for a long time. So the average age of onset for social anxiety disorder is in the early teens, but many people who have social anxiety disorder that really interferes with their life, many of people have been shy for most of their life. We do know that there's a developmental step where everybody's a little apprehensive about new people. We all know what it's like to see a kid grab onto their father or mother's leg when they have to meet someone new. That's built in. But it's pretty clear that social anxiety that persists beyond those years and into those early and mid-grade school years and into those early middle school years is a problem. And the one thing that probably catches for me most, having worked in the anxiety disorders program at the University of Michigan Department of Psychiatry for 30 years, is when people use this phrase, "Oh, he's just shy," or "she's just shy." It isn't a just problem. Social anxiety disorder is not about just. It really is, in fact, among the most common psychiatric problems in the United States, with about 13% of the general population meeting diagnostic criteria for social anxiety disorder at some point in their life, making it the third most common psychiatric problem in the United States. Major depression, substance abuse, and social anxiety. So it's very common. It's often present throughout your life course. It begins in childhood and persists without treatment. And it has a big impact, not only on work, but also in romance.
could not. I was terrified to be with other people. I mean, it was just unthinkable. If I had a couple beers to relax, it would be a little bit easier. But without drinking, I could not. I would just be totally terrified that for some reason, I don't know, it's hard for me to say why, but I know there's a lot of shame, a lot of guilt, and a lot of self-hatred, and maybe that, maybe I thought they'd find out about the real me. I don't know. I always wanted a girlfriend or a woman, and I couldn't do it. I could not talk to a woman, and I became an alcoholic as a result of that, and I was dying just from hormones to have a sexual relationship, and I couldn't. And
so we've learned a few things, that it's not only work, it's also romance, right? And Larry wants all the things that many of us want, but this social anxiety has made those things very elusive to him. And he's told a story that we've already heard about today, that social anxiety disorder, like almost every mental health problem, rarely stands alone. There are other conditions that go right along with it, and one of the ones that we've heard about today in 2 occasions is we've heard about substance use, particularly alcohol abuse. Many people with social anxiety turn to alcohol in an attempt to try to make it through, to try to approach the situations they have to approach, and to try to help them cope. Interestingly enough, we've done some research, part of my dissertation research years ago, actually tried to examine whether alcohol is very good at reducing social fear. And interestingly enough, it's not particularly valuable as a drug in helping people with social anxiety improve in their social situations. But if you believed you drank it, it's pretty useful. It's probably more the idea you've drank. We've probably been socialized that drinking really helps you feel more comfortable socially, but actually the direct effect of the alcohol is probably not so powerful on social anxiety, but it is clear that many people turn to alcohol as a way to cope. It just doesn't work very well, and it didn't work very well for Larry. Also, we heard about his despair, his depression. Definitely social anxiety disorder goes along with depression. We know that when people don't get what they're hoping for in life, they're not able to have the career they want. They're not able to have the success in school they want. They're not able to make the friendships they want. They're not able to have the romantic life that they always imagined. It's demoralizing. And social anxiety disorder, especially this generalized subtype, can interfere with so many of those important domains. So finish it out.
As far as I know, I've been unhappy for most of my life. I've had terribly low self-esteem. I mean, really, I used to look at myself in the mirror when I was 18 going, I hate you, man. I hate your guts. It seems to me that it's kind of stayed with me for the rest of my life, that image of myself, that feeling of myself, and it's just these constant, incessant thoughts going around and around in my head. Talk, you got to be able to talk. Don't be afraid, don't be gutless, don't be chicken, you know. And I finally graduated from college with honors, from a flunk out to honors, and I thought that would cure me, because if you feel good about yourself because you've done something good, then you're going to be okay. It didn't work that way. And so I was living with my parents. I was a little bit older than most people, 28 when I graduated, and I hadn't had a woman or a girlfriend. I hated myself, and I couldn't get a job. I thought, I'm afraid to talk. I'm afraid to go out and get a job. And I can remember telling myself, you know, my whole life's going to be like this. It's just going to stay like this. I'm never going to change. I'm going to be 50 years old. I'm going to be living with my parents.
So we'll switch over to the slides. I think that one of the things that Larry talks about is how his prediction that things would never change for him really contributed to suicidality for him. This idea that I've been this way my whole life, I've struggled with social anxiety, I've tried to cope with medicine, with alcohol, I've tried to get help, and it hasn't paid off for me. And I just wonder whether I'll always be this way. And the idea that he'd always be this way haunted him. So let's just talk a little bit. I only have a small amount of time, but we can remember about Larry as we go through some of these slides, some of this PowerPoint, talking a little bit about what social anxiety disorder is, a little review, and a little bit about treatment. So we know that social anxiety disorder is a fear and avoidance of social situations. People with social anxiety disorder usually avoid places, and they also sometimes endure difficult situations with dread. People with social anxiety disorder know that their fears are excessive and unreasonable, and it's clear that in order to meet criteria for social anxiety, it has to interfere with your life in one way or another, and usually it interferes in many domains. Key diagnostic questions. These are the things we ask about when we're sitting across from someone with social anxiety disorder, trying to get a sense, gee, is this a person who has this condition? We'll ask about, are they afraid of speaking in public? Almost all people with social anxiety are afraid of speaking in public. It's a really good question. However, lots of people without social anxiety don't like it either. I'm sure many of you would not like to trade places with us today. But there are lots of other questions too. Do you avoid social events? Do you fear being watched closely or doing something? Are you very afraid of embarrassment? Do you blush or sweat easily? Are any of these fears excessive or unreasonable and interfering with your life? We talked about social anxiety disorder as being present not only in adults at 13%, but in adolescents at 9%. The mean age of onset of 15 years. And social anxiety disorder in youth and in adults is present in a little bit larger amount in women compared to men. These are the things that people are afraid of: talking to authority figures, eating, drinking, writing in public, attending social events, giving a talk. Even sometimes using the public restroom is difficult for people with social anxiety disorder. We talked about the prevalence, but it is, I think, really important to understand that social anxiety disorder, people with social anxiety disorder don't only present in the general population, they're often present in medical settings. And one of the big issues that I'm trying to push forward is to try to have clinicians ask more about social anxiety disorder when they interact with their patient in a primary care setting or even when they go to a mental health center. Social anxiety disorder is often not asked about. It goes along with other conditions like depression, alcohol dependence, other anxiety disorders, and definitely it is among the most prevalent. One of the things that's really true is that suicidality does go along with social anxiety disorder, as we've heard about, unfortunately, with Andy's story today. It's particularly common, suicidality is common when people have social anxiety disorder and another problem. So this suggests that around 40% of people who have social anxiety disorder, along with either depression or other anxiety problems or substance abuse problems, very often have suicidal thoughts. It's clear also that many people don't get the help that they need. So when people have social anxiety disorder alone, only around 10% get psychiatric help at all. But if they have social anxiety along with another problem, we call it comorbid social anxiety, then they're much more likely to seek help. And here is a final part to this slide that I think is very important. Social anxiety really does deserve our attention because of this point right here. Many people with social anxiety disorder, whether it comes alone or along with other conditions, people have really a lot of difficulty finding and keeping work and taking care of themselves. So this is the problem. Let's talk just a little bit about the treatment, and then we'll move on to the next person. So we have really two main parts to the social anxiety, to the psychosocial treatment of social anxiety. The first part is exposure therapy. One of the best parts of my job, working in the anxiety clinic, is when you're working with someone with social anxiety, you got a great tool, and that tool is to practice what you're afraid of. So we do as much as we can to be creative in practicing again and again the kinds of social situations that are difficult. We know that when you're afraid of something and you practice it enough, it just gets easier. So when we have that tool working for us in the anxiety clinic, it's a great source of satisfaction to work with people with social anxiety. So often we start by calling people up on the telephone. We'll call business after business after business on the telephone, asking for their hours. Then we might ask them to describe the tires that they have available for my kind of car, or what sort of appliances they sell. And then sometimes we'll take even some risks and call up a tire store and ask whether they sell groceries also, and see whether in fact we could tolerate making a little mistake. We go to stores, we capitalize on people who are paid to talk. So we go to the mall and we talk about the 4 C's of diamonds, we talk about watches, we talk about stereo equipment, just anything to have extra conversation and conversation practice in the store, in the mall. We go to after-school activities, church groups, classes, try to talk to family members, neighbors, try to find a job where you might get a chance to interact with people. And we love volunteering. Volunteering is one of our best exposure exercises. We get around other nice people and we have a chance for prolonged interaction. And then we work up to even more difficult challenges. But it's clear that there is one thing that is important with all exposure exercises, and it's really important to repeat them. It's important to have prolonged practice, and it is often really nice to end on a positive note. So we're trying to follow these guidelines in our exposure therapy to practice what it is that you're afraid of, and that is the elixir that we use in the anxiety clinic every day. Also in social skills, in social anxiety disorder, we work on social skills training because sometimes people with social anxiety disorder have had a little trouble. They haven't practiced with people very much, so it takes a little time to learn all those small things like nodding along and maintaining good eye contact and all the small kind of nonverbal social skills that are part of getting along with people. And also how to ask a question, how to ask an open-ended question. We often rehearse these things over video and try to practice helping people get back some of those innate social skills that are probably buried in there and have been kind of put away by all this avoidance. And then finally, we do cognitive therapy for social anxiety disorder, where we try to help people address core concerns that come up all the time in social anxiety. Like, oh my God, it'd be horrible if I didn't know what to say. Why did I say that? I made a complete fool out of myself. Mind reading, he looked away. He must not be interested in me. Must think I'm weird. fortune-telling. Why bother to talk to her? She'll just reject me. So part of our practice involves doing the things that people are afraid of. That's exposure therapy. The next part is trying to polish those social skills, which may have gotten a little rusty with all this avoidance. And the final part is to try to help people think more accurately about their circumstances. So we work on, gee, is it really accurate that it's a disaster if somebody doesn't think you did such a great job? We work on thoughts like, do you really know for sure that it's going to go badly until you try it out? We try to help people kind of view their performances in a more balanced way. So these three things together, exposure therapy, social skills training, and cognitive restructuring are a very good, an excellent partnership. About 3 out of 4 people who participate in cognitive behavioral therapy get improvement, and sometimes people use medication along with CBT, we call it. The medications that we use typically for social anxiety include drugs like Zoloft, Prozac, Paxil. Those are the serotonin reuptake inhibiting drugs that you see on television all the time, or you used to see. And then also we use other medicines sometimes like monoamine oxidase inhibitors, and also sometimes benzodiazepine medications, which are big words for a group of pills that can sometimes be useful. But for many people with social anxiety, CBT is enough. For others, a combination of medicine and cognitive behavior therapy is the right fit. But the key part to all of this story is that treatment is available. Typically, you can gain access to good treatment providers by doing research in your local area, particularly in university-based clinics. And the Kukas Foundation is building capacity to help direct people to the treatment that they need. The vast majority of people with social anxiety disorder never get treatment, and the treatment that they get isn't the type that's indicated. So these events make a huge difference in both raising awareness about social anxiety, but also understanding that there's a very promising treatment out there waiting for you. It's an inspirational night for me, a really great chance to hear people talk about their circumstances. And I really appreciate the chance to come out just for a few minutes and talk about this condition which has shaped much of my career. And I thank you very much for the invitation.